All right, everybody. Today we are talking about pharma and the art of milking the cash cow. We're going to call this Eli Lilly edition. Hello, everyone. This is Dr. Ahmed Ergin. I'm an endocrinologist, a diabetes specialist, and today I'm covering a very important topic. Now, pharmaceutical companies are the modern-day snake oil salesmen. They come up with new drugs every day, slap a fancy name on it, and sell it for insane amounts of money, right? Some of them work very little. As long as they have the FDA's blessing, they can sell it for thousands of dollars. And now they want to cut out the middle players in drug distribution and sell directly to consumers. That'll be you. So the drug companies are trying to bypass doctors by trying to hire their own, so these doctors can prescribe only their medications. Are you kidding me? Well, unfortunately, no, I'm not. Eli Lilly is planning on doing this and actually is doing it. For what? To sell freaking weight loss drugs to desperate individuals who want a quick fix for their problems. Just when you thought the pharmaceutical companies couldn't get any greedier, they pull a move like this. Let's take a step back and look at the bigger picture here. Pharmaceutical companies are already making billions of dollars by selling drugs through distributors and pharmacies. Fine, okay, I'm not against making money. Yeah, sure, create something, invent something, make money, but do it ethically, dude. Apparently, that money that they're making is not enough. Now, they want to hire doctors to directly sell these drugs to consumers. Talk about a conflict of interest. Hello, FDA. Hello? Where are these guys? They are disappeared. Why? I see some green signs everywhere. If FDA is saying something, take it with a grain of salt. I'm not saying they're liars. I'm just saying that they're too much involved with these pharmaceutical companies, and then they keep their mouth shut when things like that happen. Now, these doctors are supposed to be looking out for the well-being of their patients, not pushing medications on them. They're already brainwashed by pharmaceutical companies all day long. Now, they're being hired. Let's discuss the Zepbound, for example, one of the miracle drugs, they call it, right? You know, they will say it will make you shed pounds faster. Then you can say side effects. Oh yes, the side effects. The fine print on the glossy brochure. Or on that, what do they call this? The prescribing information for doctors, and even doctors cannot read it and they expect you to know it. And pharmacists, if you're lucky, will give you a little pamphlet. They're like a surprise party no one asked for, right? From gastrointestinal issues that would make your stomach do a Macarena to headaches that will feel like migraines. It could be like a very persistent woodpecker decided to take up residence in your skull. That's what I hear from patients. Let's not forget the potential for mood changes. Some people suicided over these drugs. Well, guess what? FDA cleared it. They said, oh, they probably didn't. They probably died from something else. Anyhow, 1 minute you are shedding pounds and next you are shedding tears. It is a constant roller coaster ride. But hey, at least you are losing weight, right? Who cares? Suffice to say, Zepbound, or some people use Mounjaro for the same reason, the same molecule, the different names, exact same molecule actually. So these two things might help you lose weight, but at what cost to your overall health and happiness? Talk about a heavy price to pay for a lighter you. Now, let's turn to the elephant in the room, the increased risk of cancer with GLP-1 agents like Zepbound and Mounjaro. Now, when you disclaim something, it looks like it is just okay. Oh, by the way, this causes cancer. Oh, I told you, so if you have it, I already told you, so I'm innocent. Studies have shown a potential link between these weight loss drugs and increased risk of cancer. And that's both actually human and animal studies. And not just any cancer. We are talking pancreatitis, thyroid cancer, you name it. It's like a veritable pick and mix of some of the worst health scares you can think of. So you pop a pill or you take a shot, lose a pound, and potentially gain a tumor. Not a good deal, huh? Well, if you're needing this for diabetes or for some other serious health issues, there's nothing that can help your diabetes. I'm not against that. Sometimes you have to take a little risk to prevent worse consequences. But just for a couple pounds of weight loss, putting people at risk like this, I just don't agree with it. Talk about a step forward and 2 steps back kind of deal. But hey, at least you are fitting into those skinny jeans, right? So who cares? Just don't forget to schedule your chemo sessions between your Pilates classes. It is the ultimate paradox, isn't it? Taking a medicine in order to improve your health, while at the same time potentially thinking about or actually doing or jeopardizing your health. We would laugh if it wasn't such a dreadful reality, but next time you see a glossy ad for Zepbound or Mounjaro, remember, it's not all sunshine and rainbows in the land of pharmaceuticals. And let's not forget about the ethical concerns here. Pharmaceutical companies are supposed to be creating medications for the betterment of society, not just to line their own pockets. But with this move, it is clear that the profit is their number one priority. But don't worry, they will try to spin it in a positive light by saying that they are cutting out the middle players and passing on the savings to consumers, so be happy about it. Yeah, right. Because we all know how generous pharmaceutical companies are, right? When it comes to pricing their drugs, especially to U.S. consumers. If you live in the U.S., you're cursed. You have to pay 3 times more, 4 times more than a neighboring country or a third world country. In all seriousness, though, this move by Eli Lilly is just another example of the messed up priorities of pharmaceutical companies. Instead of focusing on the creating safe and effective medications, they're more interested in chasing profits at the expense of vulnerable individuals. It's FDA approved, right? Everybody can take it. Let's just sell it. Sell it to everyone. So, let's not fall for their PR tactics and see this for what it really is. A money-hungry, unethical move by a pharmaceutical company that is already making more than enough. Did you look at their stocks? I think it's tripled or quadrupled already. Making money off of the back of sick people. No, thank you, Eli Lilly. We know you. We will stick to our green smoothies and hitting the gym for now. And yeah, you keep smashing the supplements, call them bad and ugly, all that stuff. Yeah, of course. Yeah, work with the FDA. Take them all down. But in all seriousness, this move by Eli Lilly raises important questions about the role of pharmaceutical companies in our society. Are they truly looking out for the well-being of patients, or are they just trying to make a quick buck? And how can we ensure that the medications being pushed on us are actually safe and effective? Isn't that the reality? After 10 years, sometimes 20 years, FDA says, oops, this medication actually kills people. Let's just pull it off the market. Hello, where were you? These are important discussions that need to be had, and it is up to us as consumers, as patients, to demand transparency and ethical practices from pharmaceutical companies. And doctors must do the same. We doctors, we just watch it. We just watch it happen. Nobody says anything about it. Watch it. Eli Lilly will probably say something about me, or will do something about it on the back end, publicly or behind closed doors. Who knows, right? Sneaky. Because when it comes down to it, Our health should always come before their profits. So let's not be fooled by flashy marketing strategies and stand together against the greedy pharmaceutical companies. Thank you for watching. I'll see you next time.